Okay, let's get started then. So, yes, again, a warm welcome. This is part of a series of thought leadership webinars that Mobilityways hosts through the year. Today, we're focusing on sustainable transport strategies. This is something that obviously every trust needs to do and produce this year. And really, it's about how not just that they're written, but in terms of how they're resourced to help them achieve maximum impact. My name is Mark Hand. I'm a director at Mobilityways, which is a social enterprise and a certified B Corp who have worked in this sector around sustainable travel for about 30 years. And with us today on the panel, if we could have the next slide, please. We have Andrew Bradley from NHS England, Barry Waterhouse from Northern Care Alliance, Howard and Candice from Enterprise. And the reason that we've come together as a group is that we recognise the challenges that the NHS face in terms of trying to deliver sustainable travel amongst many competing priorities, and also the challenges that you face as individuals, probably sustainability professionals that have joined us today, in terms of producing, resourcing and implementing a sustainable travel strategy. I'm going to just start on a little bit of a glum note to today's session. It will pick up from there, I promise. If we could just go on to the next slide. Over the last couple of months, the estimate is that we've had 2,700 deaths as a result of the heat waves. 3 of the last 5 years, we've seen the arable harvests fail in this country, and this could well be the 4th in 6. In terms of livestock, they're struggling with the heat. Cows, apparently, this was new to me, prefer a temperature of around 8 degrees. As soon as it hits 20 degrees plus, they start getting stressed, which is upsetting in itself, but it also will impact on milk production and fertility. And then, of course, we've got wildfires taking place around the country at the moment, and we've only just made it to July. In my view, we're in the foothills of the climate crisis that we are approaching. So our view is that the transport strategy is a huge opportunity to galvanise the 1 million+ NHS employees into direct and personal action. And everything today that we're going to cover is about how we can support you to deliver that. So if I can just hand over now to Andrew Bradley from NHS England, and it will just cover off the transport strategy as a refresher, I suspect, for many of you, but it may be new to some too. So Andrew, welcome.
Thanks, Mark. Hello, everybody. Good morning, and glad to have you on board for this session this morning. And apologies in advance for anybody for whom what I'm going to say, at least, is a repeat of things you've heard in the past. So I'm going to talk a little bit. If you could turn the next slide on, please, Rachel. Thank you. So I'm going to talk a bit about our sustainable travel guidance, which we produced back in, which we published or released back in March now, and which is available. Anybody who wants a copy, do get in touch with me and I will share it. I suspect many of you already have it. But just by way of reminder, why have we done this? Why do we believe that sustainable travel is so important? Well, because if we don't have a plan for our sustainable travel proposals and interventions, then actually we're not going to deliver anything. And we do need to deliver something because we've been required by Act of Parliament to be net zero by 2040 for the things that we can control, and 2045 for the things that we can influence. So today, rather briefly, I'm going to head through talking about strategies as opposed to sustainable travel plans, key modal interventions, delivering a travel plan, and who is going to do the work. Next slide, please. Thank you. So why is sustainable transport important? Well, as I've said, we've been required by Act of Parliament to do this work. But also the NHS standard contract has obligations to minimise the environmental impact and that includes reducing air pollution and promoting sustainable travel for staff, patients and visitors. For many of you, the roadmap, quite literally, our roadmap on the right-hand side will be very familiar by now. We published that back in October 2023 as part of our net zero travel and transport strategy, and you can find that on the NHS England website. On that roadmap, you can see that there is a box on the top right that says 2026, that says sustainable travel strategies will be developed and incorporated into NHS organisations' green plans. And I'll come back to the fit with green plans shortly. And then in terms of a progress point, if you like, in 2033, we talk about increased uptake of active travel, public and shared transport and zero emission vehicles will reduce staff commuting emissions by 50%. Why do we talk about all of those things in the same bracket? Well, because a lot of people have said to me, hang on a minute, my trust, my GP practice, my clinic, whatever, is very rural in nature, and therefore a lot of people will have to drive. Well, we accept that, absolutely. It's not about asking people to cycle for miles and miles along dangerous country lanes or roads, distances that normal people couldn't achieve. So we accept that there are many different ways to skin this particular cat, and it won't be the same for all NHS organisations in all areas. But that 50% target is what we're aiming for by 2033. And isn't that just round the corner? The other thing to consider is in the planning of improvements on your site, capital improvements. So that might be a completely new hospital, or it might just be buildings that are being replaced. Well, those facilities should be easier to reach for all types of user, not just the person that is arriving by car. And alternative travel availability for business continuity, of course, and to accommodate climate change and adaptation is required. Next slide, please. So why specifically is sustainable travel important? Mark talked about the environmental agenda and the environmental challenges that we face, and I think we all understand and accept them. But if you're a chief financial officer in an NHS organisation, waiting lists, building problems, parking issues, there are a whole myriad sea of different things that will challenge them and challenge other members of your board, and issues which members of the public and the patients that we serve may believe are more important for the NHS to be focused on than the environment per se. So I've listed some of the issues here that are on top of the environmental agenda, because I'd be surprised, for NHS colleagues on the call, I'd be surprised if many of your organisations are not struggling with recruitment and retention, are not struggling with having to make cost savings, are not struggling with parking management, and are not struggling with attempting to make the visitor and patient experience and reduce missed appointments something that needs to be focused on. And into the mix, enhanced staff wellbeing, better air quality, and revenue generation go as well. And the quote that I've included, which is taken directly from the Sustainable Travel Guidance, with thanks to the Dudley Group NHS Foundation Trust for providing this, is from a specific individual who chose to change her mode of travel to work from driving to walking for her 2-mile journey. And as you can see, she's very thankful that she made that choice. And I think actually, if we can encourage people to make that choice, the results can be and often are better. Next slide, please. So I talked about the difference or the nuance between a sustainable travel strategy and sustainable travel plans. And I want to say that let's go to the bottom first. You are the best placed to determine what your organisation needs. You'll be only too aware of the changes that are taking place within NHS England at the moment. And it is not for people on high to tell you what to be doing. You need to work that out for yourself. What we are here to do is to try and guide, to try and enable, and where possible, to try and support the work that you are doing. But in terms of the specifics, you need to work that out for yourself. But what we're asking is, please, could you have some form of high level, long term framework that sets out your organization's overall vision and priorities for travel? And can you identify the strategic intent of how you want people to travel, both to work and for work, for business? Now, you may have produced a green plan. You probably have. Your green plan may be fairly light when it comes to travel and transport, but equally, it might be comprehensive. If it is, don't go ahead and spend hours and hours producing another sustainable travel strategy, please. If you believe that it does the job and it ticks that box, and I don't mean in a box ticking way, I mean in a actually it will help you to deliver as an organization, then that's okay. Move on then to sustainable travel plans, which are the practical operational documents that turn that strategy into action. So you may wish to have a plan per site, or if you're a community or mental health trust or a GP partnership with myriad sites, you may wish to focus in on the sites where you have the most staff or the greatest traffic problems or the biggest parking problems. Again, it's up to you. Next slide, please. So in the guidance, we talk about key modal interventions and we cover off these various issues. So we talk about public transport. We've got a range of different vignettes and linked to case studies on public transport, on active travel, on traveling differently, so car sharing, pool vehicles, etc., and of course traveling flexibly or working differently. So we don't talk a great deal about working from home, but clearly that is an important part of the mix. Next slide, please. So key considerations just for you to think on now, and the guidance goes into a heck of a lot more detail about this. But we do believe that actually you need a senior responsible officer at the top who is going to own this, who is going to be your champion on your trust or at your organization's board for travel and transport, who is going to be pushing this agenda and being able to get budget, resource, or at least your voice heard around that table. How does your organization's travel and transport resource compare to that of peer organizations? Now, they may be other organizations in your local geography, or they might be similar organizations. So if you're a mental health trust, what are other mental health trusts doing? If you're an acute trust, what are other acute trusts doing? If you're a GP partnership, what are other GP partnerships doing? Do you require additional expertise? And do you have that resource in-house, or do you need to reach out to a consultancy? Or even in some cases, there are local authorities, and I personally have worked for a local authority where we shared resource with an NHS trust, and that was very effective in terms of covering a range of different issues because, of course, travel and transport doesn't start and end at the NHS site gates. And on to the next point, how good are your relationships with key external stakeholders? Because you need to deliver that environment to make sustainable modes of travel more attractive. Who are your champions? Whether that's bike buddies or whether that's bus buddies or whoever who are going to help people within the organization, people who are championing car sharing, perhaps. And who's going to help to identify the good and the not so good about how your organization is right now. So have you got those partners working in estates, HR, various other parts of the organisation who can help you to improve? Next slide, please. Data, resources, budget, expertise, stakeholders, and commitment. You've got it all. Fantastic. Go, get on with it. If you want any background on travel surveys, we've got a sample travel survey and analysis tool that is available for NHS organisations. Again, reach out to me if you cannot find that. Next slide, please. And in terms of just delivering the travel plan and the travel strategy, if you believe you need that, we've done the guidance document. It's available. Go and have a further read. If there's any of it that you think, oh, what on earth does this mean? Please just drop me an email or even pick up the phone. And now I'm going to hand over to Barry at Northern Care Alliance, who's going to talk about work that they are doing in that part of the world. Barry.
Thank you very much, Andrew. Just to reiterate some of the things that Andrew was saying, and to just give a local NHS trust aspect to what's involved in that from there, it's that key aspect. How are we going to do the work? First thing, hands up, all honesty, Northern Care Alliance does not have a travel strategy. So as Andrew mentioned, you as the organisation decide what needs to work. We don't currently have a travel strategy. It'd be great for us to have one. But these are the aspects that we've then used to build upon that and move towards it. So the first thing to mention is that we've made sure that sustainability, transport, travel, and parking are all linked. That will offend some of our purist sustainability colleagues. Some of our parking colleagues would be in despair at the thought of having to go green. But we found, and in my experience through a long time of doing this, you need to integrate everything together. And again, for our estates, and if you're in estates and facilities, unfortunately, you've got to consider all these three aspects together to do what you need to do. And Andrew's sustainable travel guidance does make reference to that. Yeah, that's what you've got to. Next slide, please. So the other thing that we've done is we've developed an approach or process. So this diagram and the aspects within it, anybody within a transport or travel background will notice we've picked some items from some of the best advice that's out there at the moment. But basically, it is common sense. Had three different headings for this title. It was develop a process, and we try and include that on every consideration that we have in relation to travel and parking. Not easy to do. It has been a difficult process for us to do. And again, changing behavior, that first aspect is always very difficult. And initially, you're only ever going to get small numbers. So everything we've ever done in terms of this is small numbers. The other aspect, the title that I gave for it is everything, everywhere, all at once, because that literally is what, unfortunately, you need to do. It's to try and look at everything, everywhere, all at once. And that's why we've tried to add a simple process on top of this. Next slide, please. So how are we going to fund the work, which is probably a key question, which we're all on here to find out about. And for today, we'll probably be discussing further the aspects on the left of this slide as part of the presentation. Unfortunately, there is not a stack of dollar bills that are available in the corner for everybody. The unfortunate answer is, I should say, that there is budget there and money there, but you need to turn over every single rock and stone within your organization to provide it. Following in the following slides, hopefully we'll tell you about some stones that we've managed to turn over and what their potential may be. But unfortunately, nobody is going to come along, or they haven't done to me yet, with a large pot of money and then said, there you go, Barry, you get on with it. So what I'll do is hand over now to Mark, who's going to discuss further about what Mobilityways can offer from there.
Thank you, Barry. And yeah, just before we move on, just a reminder, if you've got any questions for the panel at the end, please use the Q&A facility, which is, I think you need to click more and then click on questions and answers and just put your, questions and just pop your question in there. What I'm going to cover off now and then followed by Howard at Enterprise is one way that you might be able to resource this. So a creative approach to come up with the human and financial resource to actually implement a plan. And if we go to the next slide, please. So one of the aspects is actually tackling both your grey fleet and taxi costs, whilst also addressing your commuting challenges. Doing these things together can reduce your costs, include your parking, increase your parking revenue, and help you by utilising third parties to undertake some of that heavy lifting. So just very briefly, and I will keep it brief, headline level on Mobilityways. You might have come across this before, you may not, but I'll keep this, as I say, high level. Mobilityways, as I mentioned before, social enterprise. We've been around 30 years. We work with about 200 major employers in this country and overseas, and that includes about 40 NHS trusts, but we work across all sectors and learn from multiple sectors, which I think is important. Next slide, please. Our approach to this is very much data-led, and I've just got a slide here giving an example of some work we've done with Queen Elizabeth Hospital, but the principles behind what we do is that we need to understand, first of all, how people are commuting to and from work. And it's great that Andrew's got a facility you can use for that. We're very happy if people are undertaking surveys in different ways that we can ingest that data. But the key things we need to understand from that exercise, and it needs to be credible data, so it needs to hit industry best practice in terms of what we call margin of error, so based on number of responses. What we need to understand is how are people travelling, why do they travel as they do, what are the barriers to change, but most importantly, what could encourage them to travel in a different way. And typically when we run this exercise, and we've done hundreds of them, we find about 40% who tell us that there is nothing we could possibly do to get them to change their behaviour. But that leaves about 2/3 who could be encouraged. And what we need to understand is what would encourage them to walk or cycle or take public transport, etc. Now, the other thing we can do when we undertake the survey is we can produce a baseline commuting emissions value for you, so you know the starting point. So that's one piece of the jigsaw. The second piece is an analysis of postcode data of staff. And what that enables us to do is to understand the options, the real world options that are available already, where we have gaps in provision, and then we can use that data to talk to those that could close those gaps, and what the impact would be of change. So really understanding if we got 5% more people walking and 10% cycling and 15% car sharing, what does that mean in terms of emissions? But also, what does it mean in terms of improved air quality and financial savings for staff, which are pretty critical at the moment, given fuel prices, and health and well-being metrics as well for employees. So that's the second part of the jigsaw, if you like, in terms of being data-led. And the diagram on the left-hand side here is just showing what that then tells you. So the pink is telling you what currently is happening. The green is showing that through that postcode analysis, how many people could actually use that mode. And the blue, again, back from the travel survey, is showing us how many people could be encouraged to use that mode. And obviously all the data behind is telling us what those things are that employees would like to see to encourage them to use or to change or trial a new behavior. So that's the data piece. That then moves on into a series of recommendations that would influence, I suspect, your strategy and also your travel plans about, well, what do we do about it? And that might involve car sharing, something we can do, we've done for decades. It might include using the app to actually track, with the employee's permission, of course, the mode that they've used for their commute. We can do that passively through the app. We can generate live data that shows us the success or otherwise of campaigns that are being run on a day-to-day basis. And the reason employees will engage with this is because it's also a rewards engine. So people can be actually rewarded for opening up the data for us so we can see what they're doing just during that commuting period, and also for traveling sustainably. And then there's personal travel plans that take all that amazing quality of data and bring it down to the individual so they can see their walking, cycling, public transport, car sharing options in one place, and that's free to them to use. So that's a very quick overview of our approach and how it connects potentially into your transport strategy and so on. And then next slide, please. So we've been working closely with Barry now for a couple of years. The initial results are very promising. We've seen an 8% reduction in SOVs, 28% reduction in emissions, and there's 100 less parking spaces being used. Now, this ties then into the piece that Howard's going to talk about from Enterprise, because as a result of the whole piece of work together, we are looking to reduce emissions, reduce the number of parking spaces needed for staff, potentially opening up those spaces for visitors and patients. I know, for example, when Oxford looked at this, Oxford NHS, they found, excuse me, they generated 11 times more revenue from a space used by visitors or patients than they did from use by a member of staff. And of course, the experience of those visitors and patients was greatly improved. Right, I'm going to pause there and just hand over to Howard from Enterprise to continue with the story.
Hi, nice to meet you. Thanks very much, Mark. Yes, I'm Howard. I work for Enterprise. We work with numerous public sector organisations across the UK, including NHS trusts. I'm just going to briefly explain, give you a bit of context around staff travel behaviour, in particular grey fleet, and how that impacts travel. And also just give you a very high level overview of our car club service, in which we currently supply to Northern Care Alliance, which I'll get Barry to explain a bit more how that works within the trust. Next slide, please. Yeah, so a bit of context. As you can see there, a huge amount of miles, grey fleet miles, is conducted throughout the whole of the NHS. That's not really a surprise when you consider the NHS employs over 1 million people, you know, as the largest employer in the UK. You're probably aware agenda for change rates have just increased by 5% from 56 to 59 pence a mile. But more importantly, was the shift from 3,500 to 4,500 miles of the lower limit. So that will increase trust costs substantially, certainly over the next year. The reason why this is important, obviously, from a financial point of view, as a trust, obviously you've got to look to save money, but from a more importantly, probably sustainability point of view, when you think that the average age of a grey fleet vehicle within the public sector is between 8 and 9 years old, obviously they're more higher polluting, and for the individual, those vehicles that are that type of age, they're just less reliable. You know, they tend to break down, and that could potentially impact work. Next slide, please. In terms of our car club service, we currently conduct lots of different services within the NHS, whether that's our daily rental car club or our specialist commercial division. But certainly for the Northern Care Alliance, for those that don't know, I'm just going to briefly explain what car club is and how it works, essentially. In a nutshell, it's a fully managed pool vehicle. When a user, what happens is employees of the trust will sign up to use the scheme. They will receive a unique user ID and a password in which they will set themselves. To book a vehicle, they will either log on via their desktop or via an app. They literally just type in the dates and times of their vehicle and click book now, and it will email them booking confirmation. They can book for as little as 15 minutes up to several days at a time. At the time of their booking, they walk up to the vehicle with their smartphone. They click unlock vehicle, and the car or van will unlock. The keys are situated inside the glove box of the vehicle. So they will then drive the car or the van like a normal vehicle, go about their daily business. When they're finished with the vehicle, they'll return it to the same spot and do what they did at the beginning, but in reverse. They'll put the keys back into the glove box. They will log on to the app and click end reservation. And that will lock the vehicle ready for the next user. If they needed to fuel the vehicle whilst driving it, the fuel card or electric charge card is also situated within the glove box. So there's no out-of-pocket expenses for that employee, which obviously helps with cost of living and getting reimbursed, etc. The vehicles are fully maintained by Enterprise. So every 10 to 14 days, Enterprise will go out to the vehicles. We will clean them inside and out, and we'll also conduct a 25-point health and safety check, as we would our daily rental vehicles. So things like tire pressures, tire tread depth, oil levels, seatbelt retention, etc. So you know that those vehicles are safe to drive. We have a wide range of fleet. So like I said, cars and commercial vehicles. We have zero or low emission vehicles. So we can provide electric vehicles, or if the trust doesn't have electric vehicle charge points today, we can get you going in a low emission vehicle and swap those out at a future date. In terms of the trust, how it benefits, we supply you with very detailed monthly management information. It comes in two forms. One, a high level summary, which will show you the utilization of the vehicles, how many miles they've been driven, how many users have signed up to the scheme, how many users have driven the vehicles, and all of the average CO2 emissions if they're non-EV as well. It really allows you to right size your fleet. We're actually conducting the most recent project that I'm personally working on in the South Coast. We've looked at an existing fleet of pool vehicles where they have 47 vehicles. By looking at data and the utilization of a car club vehicle, because it uses telematics, we recommend that they have 31 vehicles. So it is extremely successful. For a trust as well, they're fixed monthly costs. So it's extremely easy to budget. Some trusts will already have pool vehicles that are allocated to individual departments. What Car Club enables you to do is share that asset amongst all of the different departments and split bill accordingly. If you wanted to find out any further information on Car Club, Barry's now going to talk about how it works within his trust. But if you go to enterprisecarclub.co.uk, you'll be able to find out more information. Thanks very much.
Next slide, please. So in terms of a pilot for the car club, we've been able to do with Enterprise at Northern Care Alliance, it's first to say, we'd quickly go through this, but it's very small scale. So where we've done this trial has been at a community location. The key point to mention is the last point there, Rochdale Borough, in terms of transport related social exclusion, in terms of the cost of travel and the ability of people to travel. It is one of those areas where people struggle. So patients and colleagues struggle to get to work and reach appointments. It's not an area, even though within the B network, it is not an area that's got a comprehensive public transport coverage available for this location. Also, you mentioned in the photos, you'll see the top corner there. When I meant the original process, you can see there we've got orange and red, because that photograph there is the staff parking area. So we created capacity, but at the same time, we also manage demand, the red hexagon. You'll see them in the photos on the following slides. Next slide, please. So the car club trial, it was actually instigated by the Children's Community Service and through Workforce and HR, and was for purely those non-cash benefits identified. So 3 vehicles were placed in the nearest parking spaces from the gated entrance, and 14 drivers were then available to book those vehicles to use their trips. Next slide, please. So 2 years after the service has been operating, the Children's Community Services have been funding it from their budget. They've been struggling to fund it. However, when we've turned the spotlight upon it and looked in a little bit more detail, just with those 3 vehicles and 14 drivers, we've managed to save that much money in mileage claims. We've also, because we've no need to construct additional staff parking spaces at Callahan House, so we've actually saved money on space maintenance, and we've actually saved on the capital of building those parking spaces at the side of the centre. So we built 32 spaces rather than 48. So it actually breaks even. When we calculate those figures in, it actually breaks even. Next slide, please. So scaling up those figures, we've then looked at those sort of numbers and the potential to change 10% of colleague travel behaviour at our Fairfield General Hospital, where we've been asked about introducing Car Club, and also we have a challenge with parking capacity and demand for parking spaces. When we reiterate those figures, you can see that ultimately we believe it will give us a reasonable pot of money to play with that will allow us to fund our existing Mobilityways work that we've been doing, and we're able to get a business case through based on those parking space savings previously. But also, if we don't have to build that additional staff parking capacity, we've got the potential to save quite a large amount of capital. So we're using this to formulate business plan cases and further plans to roll out an expanded Car Club at Fairfield General Hospital. Next slide, please. Also, there's obviously the carbon savings that you see from there. Back to Callahan House, there's still more to do. And that you look at the picture of the cars down there on the public highway, that's still people who just aren't using our staff parking to come to work. But we know that there's potential to do more with those 3 vehicles and generate further savings and use those to build a bigger plan. Next slide, please. No, next slide. That's it. So from our Mobilityways data that we've already funded from that, we've also turned the spotlight upon those colleagues at Callahan House. And you can see from the figures there, the potential for the morning commute is a lot of those staff are actually living locally. So if we can remove the need for them to use their vehicle on their community visits throughout the day, there's actually quite a number that we can generate occasional travel behaviour change through, and also try and deal with that queue of parking that's down the end of the road that the local authority will no doubt be getting in touch with us about further down the line. So there is still the potential, and we've used the Mobilityways that ultimately this will fund to give us the data and the information to then proceed further. It's great if you already have this information. For us, we didn't, but we used Mobilityways to then generate this information and then share it with our wider stakeholders. Next slide, please. We can also go a little bit more granular with the information that we've managed to obtain. Those little dots that you can see are all the plots of the staff and where they live and their travel to and from Callahan House. We can look at those individual personalised journey plans. So with the case of 110 colleagues, we can actually get really granular and start to look at the particular colleagues that we could identify and see if they are able to change their travel behaviour occasionally. Next slide, please. So that then takes us on to further sources of funding. Local authorities, transport provider funds. We share our Mobilityways data and insight with our local authorities and also Transport for Greater Manchester, our transport provider. We share that data and information with them to then see if we can align with their plans and strategies and also look at what they can do. So that then leads to additional help and support, and this bit that Andrew was mentioning in his slides. Next slide, please. So that's led to further information, data sheets, PDF versions of information. We've worked with Transport for Greater Manchester and the Greater Manchester Integrated Care Partnership. They have funding available to provide us with information for colleagues about commuting or for patients and visitors coming to their appointments at Callahan House. The backside of these PDFs that they don't share is then a map of the 30-minute walking zone, the 30-minute cycle zone, and any potential quiet routes that are on there. Next slide, please. Which then leads us on to a further stone that we can uncover in terms of pots of money. It is capital development budgets. As Andrew mentioned, if there's plans for new hospitals, you'll be required to have a travel plan. There's BRIAM assessments and everything from that. There tends to be a pot of money there to fund that. We again are using our work with Mobilityways to support that because we shared that prior with the local authorities. They're also aware of that work aware of that data and information. It also helps them when they're reviewing our travel plans and making sure it aligns with their strategies and future plans. We're all getting better information and ensuring that we're supporting the behaviour change that's needed. Next slide, please. So again, this is from a Mobilityways webinar, which similar to this one was the other week, about, and where Andrew mentioned about getting this onto the radar. When I reflect back and look at the work that we've done, this is how we were able to get it to the board or get approval or get the information supported in those business cases. It was those five aspects. It was a webinar that Mobilityways produced, but reputation, in terms of certainly at board level, chief executive officer, if you can deal with that. Budget, chief finance officer. Our original Mobilityways package was approved on the basis of saving money from parking spaces. Disruption is your operational colleagues. There's always a fear of disruption, so I try to avoid being from that. Risk in terms of governance, and then for the original car club trial at Callahan House, it was retention and attraction that were the key aspects that sold that for the initial trial. Next slide, please. So I've very quickly gone through all those aspects and information, and there is a lot more to the story to describe. If it's something you would like to find out more about and to do in more detail, do get in touch with me outside of this. Certainly if you're within an NHS organisation, do get in touch to get further. But again, the next steps, Andrew's mentioned, there's the support and guidance. Look at your business cases and then use the savings and support that you can find from turning over your rocks and stones. But there are many factors. It's not an easy fix. It's an everything, everywhere, all at once, and turn over every stone. But for us, the package with Enterprise and Mobilityways, you can't sit there looking at the brick wall. Mobilityways and the data collection for us, for our individual organisation's journey, created the window. And now we're establishing that Enterprise Car Club has the potential to act as the glaziers and also keep going and keep the window clean for us, so we can keep looking out there and doing the work that we do. And I think that now leads me on. I think that is my last slide. I'll hand you back over to Mark.
Thank you very much, Barry. So we'll be moving on to Q&As in a sec. If you have any questions, please put them into the question section. Has this been useful? Is there anything you don't understand about that Enterprise Mobilityways model? Is there anything else you're unsure about that was covered by Andrew or Barry? Please put the questions in. We've had several already. And what I was going to do was just link one of those actually to this slide, which is around our next webinar. So the question was, and I will ask the panel to come on in a second and cover this as well, how can we encourage colleagues to get involved? So this next event that we're hosting is called the People's Emergency Briefing. If this isn't something you're familiar with, it's also called the National Emergency Briefing. It is an event that took place last November where a series of top scientists in the UK presented to MPs and senior dignitaries around the current status in terms of climate change, where we're at, the scale and speed of change, which is surprising many scientists, and the impact that it will have across a range of topic areas. But it also includes a bunch of solutions. And the thinking behind it is to try to secure a nationally televised briefing and discussion, and then as a nation to decide what we're going to do about it. Now, the reason I flag this is, one, I think it's great for us to have been able to secure this because there's been about 2,500, I believe, community screenings of that presentation. This will be only the second time that this has been online, and we've been able to secure one of the founders of the emergency briefing to join us, along with some other specialist panel members. And in terms of encouraging colleagues to get involved, I think this is very motivational, having seen it myself. It's very hard hitting, but crystal clear and apolitical. So in terms of members of staff and in terms of the exec, inviting them to see this could be quite useful to you. So I'm going to ask all the panel members now to join us as we move on to Q&A. And I'm going to ask that question of all of them, really, in terms of, because it's pretty important and fundamental, how can we encourage colleagues to get involved in sustainable travel? And Candice, I'm going to start with you because you've kindly joined us and been sitting very quietly waiting for this section. What's your view in terms of your experience of getting people involved with Car Club and so on?
So I had quite an active hand in rolling out the pilot scheme in Callahan House. So from our perspective, we actually feel like we were welcomed with open arms. It's a case of just a lot of the time, I think, bringing these solutions to people, explaining them, and they will quite quickly find the benefits to the staff members themselves. And each of the nurses probably have a slightly different experience with that, of how that's benefited them. It might be that it's encouraged someone to be able to walk or cycle to work. It might be a financial pressure that someone had with running an old car and maintaining it or something like that. It might have been, there's lots of different things that will affect each of those people utilising a scheme like this. But it's really just that engagement, talking to people, understanding, giving them options, that I think helps people to get involved.
Thank you. Barry, any other thoughts?
Yeah, I think it's added on to that. Unfortunately, it's a little bit like everything everywhere. But as Candice said, when you go out and talk to the colleagues at Callahan House, a lot of it was initially about an individual aspect of their life. It was quite granular in terms of what they were able to do, but then the support that the pool car gave them. And again, it's difficult, but it's trying to just catch one of those switches that switches people on to what would encourage them to change. So again, the other key issue in the sustainable travel guidance that Andrew's produced, we've not mentioned here, there's also a points of change in life as well, where we can catch people to try and change their travel behaviour, or when there's a particular aspect, and it's just to incorporate it in. But yeah, very challenging to do, but very rewarding when you're able to do it. And that was the thing, speaking to the colleagues, that we were able to do it for purely those non-cash benefits originally, and to see when the colleagues were discussing about what it had been able to do for them really was a great thing.
Okay, thank you. And Andrew, I'm assuming this question refers both to colleagues, as in the people we work with, but also the executive who we need to get behind these initiatives in order for them to be successful. What's your take on the best way to achieve that?
Yeah, I think I'd just pick out a particular issue, which is that in respect to business travel, and I think one of the questioners has put that in there, that there are a lot of NHS staff who have to do a lot of miles every day of the week to go and see people in their homes, to go and visit multiple clinics, etc. And you're not going to eliminate all of that mileage, but you might be able to make some inroads into that. And often people will cite the reason for needing to drive to work as being the fact that they then need their car for work. In the guidance, we've got an example, a good example from Norfolk, of a trust who've gone quite hard on pool cars to try and overcome that situation, so people can actually potentially travel by another means to get to site, and then there is a car available for them to use, and that could be a car club car, that could be a pool car. There are different ways to do this thing, but actually making inroads then into not only making it easier for the individual, but also reducing the cost to the organisation, which is quite key at the moment.
Yeah, and I think where you do have those pool cars, of course, that removes one of the barriers for people car sharing to work, which is that they need a car for work. So it's a double positive whammy there. Okay, Andrew, can I start with you on this one? Thank you, Richard, for your question. Will there be any grants available for funding to develop or support the sustainable travel plan process?
Sorry, struggling with the mute button. I first time for everything. In respect of that, NHS England, we don't have any grants ourselves at the moment, but what we are doing is we are working through on a number of grants that have come through from other parts of government. So, for instance, you may be familiar with the Office of Zero Emission Vehicles grants for charging points, which has gone out quite widely. And there's another round of that being worked through at the moment. So that's obviously an opportunity in terms of electrifying vehicles. On active travel, the government has announced a massive amount of money to go into active and sustainable travel. And I am aware of various parts of the country now where some of that money has been channeled in to NHS organisations, or specifically working with NHS organisations, making easier to arrive at the sites, whether that be for staff or patients or both. And one of the clear messages from government is around devolution at the moment. And by devolution, I mean not Whitehall making the decisions, not London making the decisions about funding, but actually local areas making decisions for themselves. And Barry and Manchester is a great example of where that is happening full steam ahead. So actually getting stuck into your local authority, to your combined authority, and understanding what the potential is for funding through them is really key.
Yeah, totally agree. And as another example, we've been working with North East Combined Authority, as they were then called, on a huge project in the North East to do the data work that I've been describing, and that was funded under BSIP, Bus Service Improvement Programme. The beauty of the funding pots now that sit with councils is that they are for multiple years. We're past this year by year process, which was really difficult for us all to work with. Now, I mentioned before about heavy lifting. If you need help in terms of making contact with your local authority and the people that run these pots of money, talk to us, because we are very well connected. And I suspect, and I'll hand over to Howard in a second, that that's the case also for Howard. So we can help with that. We can help sitting side by side with you, have conversations with those authorities about the value of undertaking this exercise for one of their biggest employers. You will almost certainly be one of their biggest employers in their area. And so what you can achieve in terms of sustainable travel is really important. Howard, anything to add on that and helping trusts in terms of funding?
No, not really, other than what Andrew and yourself have just said. Obviously, with regard to our solution and other organisation and other company solutions in terms of installing like a pool car or car club service, that could generate savings in itself, which will then enable you to fund other projects. That's what we've seen, rather than external funding. It's more internal, freeing up that cash flow for other means.
No, fantastic, thank you. Barry, anything to add?
I think, yeah, just to add to that, as Howard mentioned, you will probably be spending the money somewhere. It's just trying to find it and see where it is, where you can access it. But again, as we found by talking to our local authorities, we've then, and by sharing the same ideals, we've then been able to access funding and support and guidance for what we need to do. And even where there isn't a pot of money, so one of our local councils at the moment knows that it hasn't got funding for active travel, but they're keen to generate a plan. So they're keen to work with us based on the data that we've supplied to them to generate a plan, so that even when funding becomes available, we will be top of that list. So once you get in there and once you start sharing the information and trying to do this, you will find that support and help, it comes in, and potential funding. I can think over the years that there've been funding pots which we'd never have been able to tap into if it wasn't for the fact that we created this relationship with our transport authority and the local authority, and then they were able to bring us in about that. We've even had Innovate funding in Greater Manchester, which we were able to tap into to do some of our sustainable travel work, but it was only through sharing this data and information and the conversations that lead from there.
Fantastic, thank you. Okay, next question. Thank you, Andrew, for this one. Agenda, oh, it's just gone off my screen. Sorry, bear with me. Agenda for change mileage rate has been above the HMRC recommended value. Is that still the case, and can that be influenced? It feels like an incentive to drive your own car. Who would like to pick that one up? Don't all run away.
I just initially say, well, I was just to initially say, but then turn it on its head. That then is an opportunity, and that increases the savings on your business case to then look at your pool cars and your alternative options. So yes, whilst it's a problem, and they're always coming up with problems, turn it on its head. Now over to Howard to ask what a massive opportunity that'll do for him.
Thank you. Howard, you want to come in?
Yeah, I was just going to say it is a good question, and for me it would have been a lot more relevant a few months ago, because HMRC rates was 45 pence per mile, while Agenda for Change was 56 pence per mile. Agenda for Change is now going up to 59 pence per mile, but you may well have noticed that HMRC have just done a huge increase from 45 pence to 55 pence per mile. So that divide is much, much smaller than what it used to be. In terms of how that's calculated and whether they will be the same in the future, I can't answer that question, but they are calculated very, very differently. But that divide is very small now.
Thank you. Thanks very much. Right, I'm going to pick off two last ones. One very quickly, I'll just address, which is in terms of data and GDPR, what is the situation? How do we get that through governance? So, as I mentioned earlier, a couple of hundred organisations, major employers we work with across all sectors, 40 NHS trusts. We have spoken to the governance teams of every one of those organisations about legitimate interest, DPIAs, and all the other things that are connected to organisations feeling comfortable to allow you to undertake postcode analysis, for example. Going back again, I'm going to say it for the third time, helping you with the heavy lifting. We don't expect you to have those conversations with your governance teams. We would gladly do that on your behalf. We're very experienced at it. We know what the issues tend to be, and we can make what could be a massive problem into actually something very small and get that through. And then lastly, because I see we've got 1 minute to go, it's quite a long question, but it's a lovely one to finish. So I've recently done a survey as part of my LDN apprenticeship, and key themes are traffic delays, route optimization, time inefficiencies, and workload pressures and distances between our 40+ service across 38 sites and so on. Staff really keen to look at bespoke methods for their areas and co-design, currently piloting car share starting today. For wheelchair services, really interested to hear about Mobilityways and Enterprise, and a forward this to our SRO, who is doing an investment business case. Thank you for sharing really positive sets of presentations. So I don't think that's a question, but it's a great way to finish. So I'd just like to say thank you, everyone who's come along today, and a big thank you also to Andrew, to Barry, to Candice, and to Howard. There's been a lot of work put in behind the scenes to make this happen. I really appreciate all of your time. I hope that was useful for everyone. Do come along on the 5th of August. It's going to be a very interesting session, and enjoy the rest of your day. Thank you very much.
Thank you. Bye.
Thanks a lot. Bye.